Hello, everybody. This is Craig Cohen calling in to the Zoom. Sorry. Good morning and good afternoon and good evening, depending where you are. Welcome to this year's discussion around the application process for the GloCal Fellowship Program. I'll just very briefly introduce myself. So I am the one of the multiple principal investigators and director of the GloCal Health Program since its founding. We also have on the line Kimberly Bale, who's the program manager and deputy director, Julie Rowley, who is her assistant. And then importantly, we also have Nathan Brand, who's an alumnus of the GloCal program. And we have two different components for today, plus Q&A. Usually I give the overview first, and then we have one of our alumni give a talk as well. But because Nathan, who's one of our surgery residents at UCSF, has to go to clinic, we're going to have him go first. And then I'll go afterwards, and then confirm or speak the language. Anyway, I'm getting all these different things. So I think we'll have Nathan go first, and over to you, Nathan.
Perfect. Thank you. Let me share my screen quickly. And let's see if this works. Can you guys see that?
Yes.
Perfect. Excellent. So as Dr. Cohen mentioned, my name is Nathan Brand. I am a general surgery resident here at UCSF. And for the general surgery program here, it's a 5 years of clinical training and 2 years of research. And I was fortunate enough to be able to go to Tanzania on a GloCal fellowship for my second year of research. So this is just kind of a brief presentation of kind of my research time and then how the GloCal fit into it, and specifically a little bit about my project and what I was able to accomplish. Yeah, as I mentioned, my name is Nathan Brand. I'm actually now a PGY5. This needs to be updated. I was born in Minneapolis, went to school in Colorado, and then medical school over in New York. Previous to going to residency, I worked for a year in Nairobi, focused on cancer control, and am now in the general surgery residency program at UCSF. And as I mentioned, was a GloCal recipient, working at Muhimbili University for Health and Allied Sciences in Dar es Salaam from 2022 to 2023. So I think that this is a little bit focused towards maybe the HIC folks and specifically some of the postdoctoral and residents on the call, but just kind of thinking through how I was able to work with the GloCal and organize my research time. As I mentioned, we get 2 years of protected time for during our residency, and I spent the first year working at UCSF doing basic science work, looking at PARP inhibitors, which is a novel therapeutic for esophageal squamous cell carcinoma, funded through the surgical oncology T32 at UCSF. And then, as I mentioned, the second year living in Tanzania on the Fogarty GloCal Health Fellowship. So for the high-income country folks, and especially the surgery folks that have a few years, I think it's always interesting to see how you fit a 1 year GloCal fellowship into that research time. This is how I did it. This is just one of many solutions out there. And feel free to contact me afterwards if you have any questions. So as I mentioned, my research site was Muhimbili University for Health and Allied Sciences, which is located in Dar es Salaam. It's the largest health sciences university in the country. It has been a GloCal partner for a while, and actually hosted a regional GloCal meeting while I was there, which was fantastic. And it conducts its clinical care at Muhimbili National Hospital, which is the national hospital located essentially on the same campus, walking distance away. So my mentorship team, mentorship is an incredibly important part of any GloCal fellowship. My mentors included Dr. Larry Akoko, who's a Tanzanian surgical oncologist, who is a professor at MUHAS. Daruk Ozgadiz, who's a pediatric surgeon here at UCSF and the director of our Center for Health Equity and Surgery and Anesthesia, and then Dr. Cameron Gaskill, who's a surgical oncologist at UC Davis. So I'm not sure. Dr. Cohen will kind of mention what the mentorship team needs to look like for any application for this cycle. For the cycle that I applied for, it was important to have a member at the host institution, which was Muhimbili, a member, and then members at the UC institution, and then a trans member at a different UC institution that was able to provide a perspective. So that's how I came up with this team. So I am going to talk about kind of the different projects that I was involved in. The best update that I was able to make from the presentation I gave last year is our work was finally published, which is great. My primary project was published in this paper that you can see on the left, which was an assessment of the surgical oncology case volume within the public sector in Tanzania. This was recently published in the Journal of Global Oncology, which is open access. You guys can all take a look at it if you are interested. But I think the incredible thing about the GloCal Health Fellowship is it provides you protected time to work on a few other projects while you're working on your primary project, because it's not always taking up all of your time. So while I was primarily focused on this project, I was also able to help host a colorectal cancer symposium at Muhimbili, and assisted again with another liver cancer conference later in the year, also at Muhimbili. And these are just a few of the smaller publications that came from both of those projects as well. So for my primary project, which was looking at the surgical oncology case volume within the public sector in the country, the problem statement was that essentially before I did my project, had been no systematic assessment of surgical oncology services that had been done in Tanzania at the national level, and little was known about the geographic trends and capacity of and access to surgical oncology care within the country. So, a little bit of background for those that are unaware. Globally, it is estimated that in 2020 there were 19 million new cancer cases and 10 million cancer-related deaths. And in Africa, especially, the incidence of cancer is expected to double by 2040. Globally, 5 billion people are quoted as lacking access to safe surgical care. So the combination of these two, especially in low-income settings, mean that many people do not have access to high-quality cancer surgery in low middle-income countries. So in Tanzania, there were only over 40,000 new cancer diagnoses that are made each year. This is a number that is obtained from GloCal, which is based on registry data and imputed data from the region. In the country, which has a population of over 65 million, there are only a few different cancer centers. The Ocean Road Cancer Institute in Dar es Salaam is the main one, and then there is also cancer care that is provided at the national and zonal hospitals. So you can see this is Ocean Road Cancer Institute, Muhimbili National Hospital. And then the other regional hospitals are the Mwazi Moja Hospital up in Dar es Salaam, Mbeya Regional Hospital down in Mbeya, Benjamin Nkapa Hospital in Dodoma, Kilimanjaro Christian Medical Center in Moshi, and Bugando Medical Center over in Mwanza. In the Tanzania healthcare context, primarily elective surgical cases are primarily done at the national and the zonal referral hospitals. So we wanted to focus our assessment on these hospitals, as most cancer surgery, ideally all cancer surgery, but most cancer surgery is done in the elective setting rather than the emergent setting. However, because unfortunately many times cancer does present itself as an emergency, and many emergency surgeries are done at the regional level, we did include a few regional hospitals within our assessment. So we included in this assessment, we looked at all of the the national referral hospitals that do surgery, all of the zonal referral hospitals that do surgery, and then we included a few of the busiest regional referral hospitals in the country to get just a sampling, a convenient sampling of the cancer surgeries done at the regional referral hospital. So what we did was we visited all of these different cancers, all of these different hospitals. In total, there were 10 hospitals throughout the country, and we looked at the operative logs that are kept for each surgery that is done within the hospital. So previous studies have looked at how accurate these operative logs are, which are the logs that you have to write in before and then after you're finished with the surgery. And what they found is they're about 90% accurate, which is actually a great source of data to be able to use for this. The limitation of the work is that the logs don't have very much information. It is really a log just to show kind of what the OR room was used for and grossly what the findings were. So in general, what you were able to get is a name, a gender, the date of the operation, the age of the patient, and then the post-operative, what was the surgery that was done, and the post-operative diagnosis. So the strength was that we were able to go to 10 different hospitals within the country in a single year and review, I think in total, over 25,000 different surgeries that occurred. Over 65,000 different surgeries that occurred. But the downside was that the information that we got on each cancer surgery was a bit limited. So this is very much a high level kind of scoping review of how much cancer surgery is done within the country, but lots of questions left to be answered. As you can see, this is kind of taken from the paper that we recently published, but you can see how many operations that were done and how many of those were cancer surgery. And as you can see at one of the findings was that at the national level, about 10% of the surgeries are for cancer because this is at the specialized hospital with the specialist surgeons. Whereas if you look at the regional level, if you look at Tonga Regional Referral Hospital or Secatori, they are doing a significantly fewer proportion of cancer surgeries compared to the total number of surgeries that they're completed. So it is showing that most of the cancer care is being done at these specialized zonal referral hospitals and national referral hospitals. So in total, you can see that we looked kind of at the different surgeries that were done, and we tried to put them into different categories as if the surgery was done for diagnostic purposes, treatment purposes, palliative purposes, or reconstruction. For the surgeons among the group, laparotomy is a really kind of vague term that it could be done for diagnosis, treatment, or palliation. So rather than try to assume what the laparotomy was done for, we just had this as an additional category, which is essentially an other or a non-categorical, the surgeries that couldn't be categorized. But either way, you can see that of all the surgery that is done, only 42% is done for treatment-related intent, whereas a quarter is done for diagnostics and a little over a quarter is done for palliation. However, if you look specifically at different types of cancer, for breast cancer, a majority of the surgery that is done for treatment for curative intent with 83%. And you compare this to kind of prostate and esophageal cancer, where 80% are done for palliation. So this is just kind of a high-level smattering of both the project that I did, where I was able to publish, and some of the findings from it. I don't want to waste your time with a research talk because the primary intent of this Zoom is to focus on how you guys can learn more about the GloCal Fellowship in general. But as I wanted to highlight is it really provided an incredible opportunity for me to further my global health career as an academic clinician interested in creating a career in doing global health surgery and global health research. The GloCal provides a number of opportunities and I think is unique in that sense that it really gives you an opportunity to lead your own funded project with multi-level mentorship. There are plenty of different grants that allow you to be a part of a team, but the GloCal provides you the opportunity to really take a leadership role in a project while being supported by mentors both in your host institution as well as within the UC system, which is an incredible opportunity to learn how to lead projects, which is important for anyone to want to go into a career on this. In addition to kind of the overall setup that provides that support and mentorship, there are ongoing works in progress meetings as well as a seminar series that continue to strengthen your research skills and provides you opportunity to present your work in the unfinished stages to your peers and experts to be able to get feedback on how to move forward. It provides you an experience with obtaining an NIH grant, which is an incredible opportunity. And then it gives you preliminary data to build upon. As you can see from the brief amount of data that I presented, it, I think, raises a lot more questions than it answers. So it really provides me the opportunity to go back and write more grants for additional funding based on the preliminary findings that I was able to find through the GloCal fellowship. So I'm going to keep it short so we can hear from Dr. Cohen and others, which I think is what you guys really want to hear from. But this is my email address. If you guys forget it, it's just nathan.brand, which is my name at UCSF, which is where I'm training, .edu. Feel free to email me with any questions that you have, and I will do my best to respond as quickly as possible and answer them to the best of my ability. But thank you guys so much, and I'll pass it back over to you, Dr. Cohen.
Thank you so much, Nathan, and thanks for taking time out of your morning before you're heading off to clinic. So I also just want to acknowledge that we have a lot of different people on this call, almost 70, including faculty, including, importantly, leaders from our partner institutions, which I'll be talking about in a moment. So we have our several of our site PIs are on, and I'm going to ask you to introduce yourself in a moment. We can get to that section. And Julie Rowley, I hope, is going to be having and we also have prospective applicants. So we're going to have Julie Rowley put up a poll because you just want to know who's here. And right now it's difficult to know. We just see names, who everybody is. We do want to know if people are where people are coming from. So that would be helpful for us. But I think before we get into that, I'll get started with presentation just to follow up where Nathan ended. Hopefully this will work. Okay. All right. Everything around. All right. So I'm going to give a brief overview about the fellowship program. We're now going to be moving into our 13th year. You'd be applying for the 14th year. Program has been around for a while. All right. So the fellowship is really about supporting the next generation of aspiring global health researchers across a whole melee of disciplines, including transdisciplinary global health research, clinicians, non-clinicians, people from the US, as well as people from our 18 countries where we partner, where we have 22 partner institutions. And I'll be talking about that in a moment. So the history of the program is it was established in 2012. We're one of 7 programs that comprise of, so FIC stands for Fogarty International Center, which is a center within the NIH. It's actually the smallest center within the NIH, but supports global health training, both for US trainees and trainees specifically from low and middle income countries. And the program is one of the launch programs, which launch stands for Launching Future Global Health Leaders in Global Health. We so far, in our first 13 cohorts, we've just started our 13th cohort in July. We've had 193 fellows that have been funded in this program. And this represents anywhere from about 10 to upwards of almost 20 per year. It depends on the amount of funding that we get. So this program is not directed by me alone. We have 4 multiple PIs, including Natasha Martin at UC San Diego, Beatriz Martinez Lopez at UC Davis, and he goes by J. Lee at UCLA. And then, as I mentioned earlier, we're supported by Kimberly Bale and Julie Rowley as well. So there are these four kind of primary UC campuses. For those of you who know about the UC system, we comprise of 10 campuses. We're very fortunate that Berkeley has its own program called Global Health Equity Scholars. We do work with them closely as one of the other consortia. That consortia is now being led by Yale University. But we are really interested in encouraging applicants from across the entire UC system, including Berkeley, but also the campuses that are not represented by the multiple PIs. So the program has, here we are. So we now have a poll that we'll just take a break for a second. So if you say, I guess you can vote on the poll, not vote, but designate who you are. So we'll do that just take a minute to interrupt my presentation. Doesn't look like I can vote, but that's okay. All right, so we were almost up to about half of you. If you can just click on the correct, hopefully there's one of those designations are for you. So, which I'll be getting into, these are the different, not the faculty, but the various U.S. postdocs and so forth. These are the type of individuals that can apply to the GloCal program. You know, if you just there's a few more of you that maybe don't fit this designation. I think why don't we just wait another second? All right. So Julie, why don't we end the poll so I'll continue the talk if that's okay, and just there's one UC faculty member. Okay, great. Then just record those numbers somewhere. Okay, great. Thank you, everyone. All right, let me get that out of the way. Okay, so the various program components that make up the one-year program. So the primary focus of the program, as was that Nathan mentioned earlier, is you really have the opportunity to conduct your research. And this is a research program that will last anywhere from 9 to 12 months. I'll mention why there's a range there. This is really for hands-on research. Now, you're not doing this completely alone, but we do expect that the research ideas are something that you are making major contributions towards. We're really looking to advance in the next generation of researchers that eventually can become independent researchers, but you're being supported by a team of mentors. So mentorship is an essential component. We do provide some resources for global health education. These usually are online courses that are either available through one of these campuses, but there may be a resource that comes from anywhere in the world. There's a career development component where we meet about almost a dozen times throughout the year to highlight the careers of various individuals, either recent graduates of the program or very well-established global health researchers. And then we also have an enhanced training element. This is why it's 9 to 12 months. So this is a newer element to the program that we're now, it started about 2 years ago, where it's required that our postdocs who are coming from our partner institutions will spend 1 to 3 months at the UC campus where your primary mentor is located. It's actually a component of the application. You need to pre-specify, working with your mentors, what it is you would plan to do. It has to be something that's very meaningful and relevant to your research and to your career. It has to be something that can't be done virtually. So like a course that's virtual that you're taking now while you're on campus would not fit. Spending time with your mentor is certainly critical. And there's different examples we can provide to you, but it's really for you to work with your mentors on developing that plan. In addition, we started 2 years ago in partnership and really the leadership of Willie Lascano, who's on our executive committee and also serves as a site PI for Universidad Peruana Cayetano Heredia in Peru. So just created a global health certificate which the components include one of the UCSF core courses that you may choose to take. If you're in the certificate, you essentially have to take it. It's called Design and Clinical Research. It's offered during the North American summer. Then there's these didactic global health seminars with discussion that are led a lot by our faculty, affiliated faculty from around the world. So although the program is from Cayetano, we have people that are giving these talks from Kenya and Mozambique, from Vietnam, etc. And then you also need to document that you spent time with your mentor. And then through that, if you fulfill all the requirements, then you have the opportunity to get a certificate. You're eligible no matter where you're from, if you're a US fellow or a fellow from any of our partner countries. All right. So probably a lot of you already know this. We work with in 18 countries, a high number of them in Africa, especially in Southern and Eastern Africa, although we also work in Cameroon and Ghana. In some of the countries, like in Uganda, we actually have multiple partners that we work with. So you would need to select the one where probably you already are at, where you have the strongest connection if you're coming from that country itself. We have our newest partner is CIDERS, which has a very robust research and training program in Zambia. So we're excited to have them on board. Asia, we have the countries mentioned there, and also in Latin America. You can see the countries too. Okay, so who's eligible? So U.S. postdocs are eligible. You've heard the example of Nathan. He's in his surgery residency program and took one of the research years to do the GloCal fellowship program. It can be, if you're a physician, to be at the conclusion of your residency program, or it could be a component of a fellowship program. If you're doing any specialty training, you can bring this in. We also try to encourage, when possible, co-funding. So, for example, if you're funded on a what's called a T32 NIH T32 grant, excuse me, you can then also apply to being GloCal, and we usually work out with your program who funds what element of that year. I should say that for U.S. postdocs, you can come from any institution. You need to be a U.S. citizen and resident. You do not need to already be within the UC system. We also accept applications from applicants across the 18 countries where we work, which I just showed you. Again, this is anyone with it can be an MD or MD equivalent, like an MBCHB from Eastern Africa. It can be a PharmD. You can have a PhD in nursing or a PhD in any discipline. That's totally fine. And you then are going to be eligible. And then the senior professional students, this would only be for US students, would be people who are in the MD or dental program or a veterinary medicine program or PharmD program would be examples. In this case, you need to already be within the UC system in order to be eligible. And then the advanced doctoral students, these are PhD, DRPH. Again, you need to be from one of the 10 UC campuses in order, and a US citizen and or resident in order to apply. So GloCal prides itself in being very transdisciplinary. Of course, we have a lot of people doing research in the more traditional health areas that include public health and medicine and dentistry, pharmacy, veterinary medicine. But we also have had a lot of people who combine health with non-health disciplines, whether it be genetics or the social behavioral sciences, engineering, mathematics, anthropology. One year we had someone who was in the oceanography, the Scripps Institute down at San Diego, and was combing the oceans for cyanobacteria that producing novel cancer therapeutics. So there's lots of different opportunities. Again, I think at its heart, global health is transdisciplinary. So the more creative you can be, something that I like. Of course, you need to have a competitive application, but totally encourage. And again, your mentorship team should essentially mirror what it is you were trying to do as far as what disciplines you're bringing to the table. So how are the decisions made? You submit your applications. I think you all know that the applications are due. This year, we decided to have them due earlier, so they're due hard deadline of September 16th. And then there's an initial review of the applications, which is performed by our steering committee, which is comprised of members, faculty from across the UC system, as well as many of our partner institutions in other countries. About half, usually we end up with about 40 or so applications, about half of whom meet the mark after they've been scored and are requested, shortlisted for an interview. And then the panel interview, which is comprised of the steering committee members who already evaluated your application, along with one executive committee member, which is comprised of the MPI representatives, Lucy from South Africa, Tony Raj from St. John's Research Institute represents Asia, and then Willie Lascano, I mentioned earlier, represents Latin America. But again, we mix it up. You may have Willie, if you're from Kenya, you may have Willie on your interview panel and vice versa. And then there's ranking and recommendations are made to the leadership group. And then decisions are made on usually who's accepted, who's not accepted or rejected. And then we have usually a lengthy wait list. And I'll talk about that in just a moment. And the decision on acceptance is not just straight who gets the highest score, that we try to follow that as much as possible, but there are funding priorities. A significant proportion of our money is allocated for HIV-related research. It really needs to be central to your application. It can't just be peripheral HIV research. It really needs to sit within the aims and within your title and within your approach. And then also our notice of award from Fogarty requires that 60% of our core funding is going to go towards funding US postdocs. So we have historically been able to fund a large number of postdocs from our partner countries, but there is that twist of priorities, initial priority, at least for our US postdocs. And so the wait list is oftentimes a way that we will fund many of our postdocs coming from our partner institutions. And this year, because the applications are due earlier, I think we're gonna know earlier when we get additional funding. Now, who do we get additional funding from? Our core funding comes from the Fogarty International Center, which I mentioned earlier. It has HIV money and non-HIV money. It has money for US postdocs, and then for the low and from our partner institution postdocs, as well as from our doctoral and professional students. But historically, you see this list here. I'm going to put this in the chat for you, because I can get the chat open. Oh, yeah, there's chat. Sorry, almost there. I'm going to put this list in the chat. Yeah. All right. So you might want to get that, copy paste that from the chat if you're interested. The reason is that we get a lot of co-funding. So we get our core funding, which funds about half of our trainees. The other half, what happens is we take our most meritorious applicants, we put together, and Kimberly and Julie do tremendous work putting together your application along with the reviewers' comments, again, from the steering committee and leadership group. And then we send that on to the Fogarty International Center. That then we leave that in their hands. They take all the meritorious applicants from all 7 consortia, and then they send it to these. Many of you might not know. I might not know what these all are. These are NIH is comprised of 31 institutes, centers, and offices. This is comprised a subset of those that have contributed meaningfully to GloCal specifically. So, for example, NCI is the National Cancer Institute, the largest institute at NIH, followed by NIAID, which is National Institute of Allergy and Infectious Diseases. NEI is the National Eye Institute. I'm not going to go through all of these, but you can figure out ideally which one might fit for what your area of interest is. What you can do, and with your mentors, is you can identify, let's say you're an ophthalmologist. Most likely, then you're going to be interested in NEI, National Eye Institute. You can look at their global health program and see what their priority research areas are. And then you can ensure that your application, your research idea, is going to fit within that priority area. I hope that makes sense, right? Same thing for the National Cancer Institute for all of these. There are the ones that start with O, those are offices, like OAR is Office of AIDS Research, OBSSR is Office of Behavioral and Social Science Research, and on. We've gotten significant funding recently over the last few years from many of the, not just institutes, but the offices. So you can make our job easier if you can align your research as closely as possible with their priority in the institute that you think best fits your area of research. All right. All right, I'm going to move on. So I'm just going to give you an example of, you heard from Nathan already, but just give you an example of some of our more recent graduates of the program, or alumni of the program. So Huan Dong was a medical student at UCLA Drew program in Los Angeles. He studied antibiotic resistance in Vietnam. He's now a pediatric ID fellow at UCLA. Kendra Bird was a doctoral student affiliated with at UC Davis, studying the understanding associations between infection, inflammation, and status in infants. She did her project in Kenya, and she's now a senior research fellow at the University of Greenwich in the UK. Lauren Hack was a US postdoc. At the time, Mexico was one of our partner countries, so she worked in Mexico on school home programs for youth with attention behavioral concerns. She's now an associate professor in the Department of Psychiatry at UCSF. And she's also joining our scientific committee as well. Hendry Sawe was a postdoc from MUHAS, studying emergency care of acute episodes of illness with major chronic diseases, of course, in Tanzania. He's an associate professor and the head of the emergency medicine department. He's also been fabulous. MUHAS has been a very strong partner for GloCal, serving as the site PI and also a steering committee member. Larissa Otero was a postdoc from UPCH in Peru, studying prevention of tuberculosis in children. She's an associate professor at Cayetano, and she received the first K43 with the Emerging Global Scientist Award from the Fogarty National Center in Latin America. She's also on our steering committee. Oh, sorry, she's on our trainee advisory committee. Chimtai Mungo was a postdoc who was co-funded by T32 at UCSF. She's an OBGYN. She studied the prevention of cervical cancer among women living with HIV in Kenya. She's now an assistant professor in OBGYN at UNC Chapel Hill. I've had the privilege of serving as one of her mentors for over a dozen years. All right. So as you heard, I think you understood mentorship is really a key element, really key component for this program. We've been very successful in ensuring that our fellows have been well supported by their mentors, both from their home institutions as well as across the University of California. So we have these requirements for mentors. We really believe in team mentorship, that no one mentor is sufficient to train you. We also, again, encouraging transdisciplinary, multidisciplinary research. So by its definition, you need people who have strong disciplinary expertise in several areas. So you're going to need multiple people. Because of the nature of the award, one of your co-mentors needs to be from one of the 4 lead campuses, so Davis, LA, San Diego, or UCSF. One mentor at least needs to come from either your institution in your home country, or if you're from the US, the institution where you plan to work. And then we have this concept of trans mentor, who can be a senior investigator in a different field of expertise. It can be from a different geography, can be from another UC campus, or it can be another person at your home institution, for example, in Kenya or Uganda, depending where you're coming from. And we need letters of support from these 3 individuals. Oh, and new this year, this is important. Hopefully people know what the NIH BioSketch is. It's a up to 5-page document. New this year, we need your mentors to submit their bio sketches with the application. We've not previously required that for people who've been mentors in the past, but the Folk International Center is making this a requirement for your application, and I think it will help with vetting your applications, especially if you're on that wait list and are going to the various other institutes for potential co-funding. So the expectations of the mentor are we want them to be involved in developing your research proposal. So I've already received a few of you, I don't know if anybody on this call, but a few like, can you review this for me? I'm like, have you reviewed this with your mentor? And I haven't heard back. So the answer is probably not yet. I can look at things, but they need to be well vetted by your mentorship team before I should be looking at these, your research concepts. Or any of the MPIs as well. One of the 3 mentors will serve as your primary mentor and will be in contact, should ideally be in contact with you weekly. This could be in person, ideally, or depending where they're located, it could be virtual. And all members should have a monthly conference call with the trainee. I think having a mentorship team approach, having all your mentors on like a virtual, like a Zoom, at the same time can be a real benefit to you to hear multiple voices because not everyone's going to agree, and you'll gain from that experience. And it's expected that all the mentors will work with you, not just the 1 year, but extend their support because you're not going to finish with your data analysis and publications during the 1 year period of time. Okay, so tips for successful application. We have examples of successful applications on our website. I'm sure you've all been on the website. The mentors need to review and provide feedback on all elements, including if you're coming from international site, they need to work with you on developing what this at least 1 month, up to 3 month period of time is going to look like, what you're going to spend at the University of California, wherever your mentor is located. And they have to send in the letters of support, and we need to be received by September 16th, which is the deadline for the application. So we've been very fortunate. Now we have 7 launch consortia fellowship programs. We've had a lot of collaboration across the 7, including the orientation, which has happened the 2nd week of July. It's a fabulous week. It's part of the program. It's held on the NIH campus in Bethesda. It's a week-long program. I truly enjoy getting to meet all of you, who or at least are accepted. As well as getting to meet the fellows from the other programs, as well as the faculty. It's also an opportunity to meet with the many of the leaders of NIH. Tony Fauci, I'm sure everybody knows who Tony is, gives a wonderful plenary talk, and people get to talk with him. This year I missed it, but I heard there was a book signing. So if you're interested in that, there's opportunities for that. Because a lot of research, and part of this is building relationships. So you have that opportunity to do that, as well as to learn from the alumni in the program. We've held regional workshops. The first one was in 2023. MUHAS was the host of that. That was for our fellows from Eastern Africa across all 7 consortia. And this past May, we held one at Hanoi Medical University. Terrific host for Asia. We had about 20 fellows present, as well as 7 faculty come for that. We have a panel every year at the Consortium for Universities and Global Health. We had a special issue on mentorship in global health in the American Journal of Tropical Medicine and Hygiene, and many other things that we do together. It is important if you're looking at multiple programs, which is totally fine, you only can apply to one program. And after the applications come in, the program managers check lists to make sure you've only applied to a single program. So please don't apply to the program that best fits you, your needs, that connect with your mentors, have historical connections. In our case, University of California. Then apply to GloCal. If you're most closely affiliated with Harvard, apply to the HBNU consortium, University of Washington, and et cetera. Apply to those consortia, the best fit for you. There's not really competition from that perspective for applying. Okay. So the deadline, again, September 16th, connect with us, correspond with us. This is Kimberly Bale's email. She's amazing. She helped create this program. She's an amazing resource. I'm available. The other MPIs are available. The site PIs from our 22 partner institutions are available to help you. We're all here to help. So, okay. So now we're open for questions. I think Nathan probably had to leave. I just wanted to, if you are one of our site PIs, if you just want to take a moment and just say hello, I just want to give you the opportunity to do that because you obviously are the reason why we have GloCal and why the program has had the impact it has so far. So I see some people. If you just want to unmute and just say hello, I'd appreciate it, and just where you're coming in from.
I don't actually see any site PIs on here, but
I see Majid. He texted. Okay. All right. Fine.
Hi.
Hi. Oh, there you are. Okay, great. You just want to say hello and.
Good morning, good afternoon, good evening, everybody. I'm Majid Fasih Harandi, and I'm professor of medical parasitology at the School of Medicine in Kerman University of Medical Sciences in Iran, and I am very happy to be here with you all. Thank you, Dr. Cohen, for your presentation, and I'm happy to inform you that we have 2 potential candidates from our institute by now, but I hope more applicants are coming in, and thank you for all the details you provided to us. Thanks very much.
Thank you very much for being part of GloCal and for your leadership and for encouraging people to apply. So I just want to, so we're open for questions. I think if you just want to, you can raise your hand and I'll just call on you and then I'll unmute. If you go down below to reactions, I think you can just raise your hand from there. Usually. Okay, Constantine, you're on. You can turn on video if you want or just talk. It's up to you.
Yeah, thank you very much, Cohen, for the very important submission. Now, my interest is in the issue of getting mentors from the US. I think that has been a teething problem or challenge, I would say. Because sometimes when we communicate to these potential mentors, we hardly get replies and things, so it gets a little bit hard. So I'm not sure whether there's a way you can really help us to reach our potential mentors, because from today to the 16th September, I think that is a fairly short time to get these things done. But of course, if we want to get there, we need to work a little bit hard.
Yeah, let me respond. So thank you, Constantine. And can you just let me know what institution you're planning to apply through?
Thank you very much. I will be applying from the UTI RRC in Kampala with the TB program.
Okay. Well, so
yeah.
Okay. So you're doing TB or TB HIV research, right?
Yeah, that's
There's
correct.
a very strong collaboration between our 2 institutions, right? Right. It's essentially at Macquarie University. You need to work with the site PI for that center and have him reach out to his colleagues at UCSF. Because right now it is, just so people know who are calling in from Africa and Asia, it's the North American summer. People are on, people are off, people are on vacation, people have grants due, and then they get an email from somebody they don't know.
Sure.
Is there less in an idealized world, they should respond. But have the people that have the connection with their faculty, or with their faculty colleagues at UCSF or any UC campus, make that introduction for you. They have their WhatsApp numbers, they can email. That's my strong recommendation. If that's not successful, you can let Kimberly and I know, and we can try our best as well. But it's really best if your site PI makes that initial connection.
Thank you so much, Cohen. That's very helpful.
Okay.
I
Yeah,
appreciate
and
it.
that's true for everyone, not just you. Yeah.
Okay.
Okay. Another question? So all these people, no questions.
But we have a bunch of questions in the chat. I'm trying to respond to some of them, but
Do you want to
you may
just
want
mention them
yes.
so that everybody can benefit?
Yeah, starting at the top, here's a question, and if this was related to the different ICs funding, and if that area of research does not have appropriate funding, but the idea is there, would you suggest working through a different office branch?
There's almost like a double entendre there. I'm trying to understand the question. So if you're interested in a research topic, but what I think you're saying, but I could be wrong, and maybe Nicole, you could answer. If it's not a priority area, should you be thinking about another topic? Is that your question?
Well, thanks so much for answering. You had a wonderful suggestion in the application to prioritize a specific institution. So say that I prioritized NIM, but they maybe didn't have enough funding and NIAID had the funding. Would you come back to me and say, we're going to do this through NIAID? I just want to make sure that I'm not focusing too specifically on something.
Yeah, okay. Right. So some of you are going to be interested in doing research in areas that may be covered by more than one institute or office. So what we do is you'll do your best to focus the research ideally in a specific institute, but we will identify other institutes and or offices that may also be interested as well. You don't need to do that part of the work. And then in addition, when we send the table of everyone's application off with the potential, I'm going to use the term ICOs, institutes, centers, and offices, our program officer will then do the same thing and like, oh, okay, Nicole, okay, it looks like she put down NICHD, but we know that we've had really good interest from NIAID lately. Let's send this to both programs, both NIAID and NICHD. Does that help?
Super helpful. Thank you so much.
Okay. Let's see. Great talk. Someone with an MPCHB that's equivalent in the US context to an MD can apply. My caveat there is that if you do not have an additional degree, like a master, either an MMed or an MPH or another degree or significant research experience, this is not spending your summer or your fall doing research. This is like several years of research, a few publications under your belt. It's probably early for you to apply to this program. It'd be better for you to look for other D43, so other training programs or other sorts of training programs, and to get more field experience before you would move into, and even a degree before you would be successful at applying for this program. This is really meant for people who have some degree of research experience already, unless you're a US doctoral student or professional student. Hope that was clear. Okay, Peter, I see your hand up. Okay, I see another question here.
Can you hear me?
Peter, go
Can
ahead.
you hear me now?
Okay, go. Yeah, go. I'm ready, Peter. No, not hearing you. Okay. Let me answer this next question. So this is from Asafas. I have a mentor from UCSF and Uganda. Could you guide on the trans mentor? So what's my answer going to be?
Hello.
My answer is, yeah, hold on, Peter. I'm just answering Asafas's question, and I'll come back. Just hold on, Peter. So my answer is going to be go to your mentor in Uganda and UCSF and ask them for their recommendations first. If you still need help, you can reach out to Kimberly and or myself at UCSF. Again, the trans mentor can come from any institution. They could come from Uganda. They could come from any UC campus. They can come from another university in the US, or that's up to you. Okay, back to you, Peter.
Thank you, Cohen, for the opportunity once again. Quickly, I wanted to ask if my idea, I would love to nest it maybe within a running project. Would that be also acceptable to run my fellowship within a running project, my GloCal fellowship?
Thank you, Peter. Yes, I think it's very acceptable to do it that way. Your project does not need to be completely independent. I think nesting it with an ongoing study can be a great way to leverage resources. You just need to make sure that what you're proposing is distinct from what already is funded. So that you need separate aims from what has already been, whatever the parent project is. Okay, that's Peter. And then Unag.
Hi, Craig. Thanks so much for the info session. I just wanted to check. I'm from South Africa, and your partner institution there is the Desmond Tutu Health Foundation. And the person that's given as the local PI to contact, Andrew Medino, I have emailed him, I don't know how many times over the last like 4 months, and he just never responds. So do you have some advice? Because now the time is really short for me to develop a project. And I don't know who to contact.
Yeah. So I know Andrew very well. I know he's extremely busy, has 2 young kids and all this stuff. Send me the email and I'll make sure that he responds.
Okay, thank
I'll
you
also
so
send him
much.
a WhatsApp text. What institution are you at in South Africa?
Well, I'm actually at UC Davis, finishing
Oh,
my
okay.
PhD,
Got
but I'm
Okay.
doing field work in South Africa right now.
Okay. Yeah, I mean, they're best place to be able to support fellows in either the Eastern Cape or Western Cape.
Okay.
I hope that, I mean, that's really that's where they have a field office in East London, and then they're, of course, based in Cape Town.
Okay, no problem. Thank you so much.
So send me the email, yeah.
I will do. Thanks, Craig.
Okay, sure. I see a question about a postdoc at UC Santa Cruz from India. You're not an American, so this is from Alka. Yeah, so Kimberly already, so if you're a US resident, and I don't know if you are or not, you could apply as a US postdoc. If you are not, then you would need to apply as a postdoc fellow connected with St. John's Research Institute in India. Oh, and we also have one other partner in India as well.
And by resident, we mean green card holder.
Sorry. Yes.
Just
green
to
card.
make sure.
I don't know if
just
it's still
residing in the
green, but
US.
if it is. What is the time restriction? Okay, you answered that. Well, you need to have your PhD. Sometimes we get, it's fine to apply while you're finishing up your PhD, but you need to have a PhD in hand by essentially June 30th, in this case, 2025, in order to matriculate as a GloCal fellow. If you're a US candidate. If you're from a LMIC and have another, like an MBCHB, and you're working your PhD, then the MBCHB counts as the doctorate. Chairman, hi.
Hi, yes. Thank you for that wonderful talk. And my question is, I'm trying to reach the mentor from the UC, and maybe my question is like, is it possible like to use two different mentors and apply to different but the same application with the same study site? Maybe like to maximize the acceptance rate or yeah.
So
Or
are you
am I
talking about applying to two launch consortia?
no with the yes with the same UC but two different mentors.
No, don't do that.
Okay.
That's not good. By the way, I would appreciate if people introduce themselves and at least say where they're calling from and who they are.
Oh wow, oh, that's amazing. Okay, my name is Sharonet. I recently completed my PhD here in Canada, but I'm a US resident, legal resident, and currently
Okay.
I'm just reaching, with the Kimberly several times. Maybe she knows. Hi,
And
Kim. Nice to see you.
where are you hoping to work as a fellow?
Yeah, we just working with the Tanzanian. Because we do have
Okay.
very strong relation with the Tanzanian, and I'm still working with the UC teams, but still, we've made a little bit of conversation, but nothing yet came to the table. I'm still
Mhm.
trying, to finalize everything, and yeah, hopefully we will see. Anyway, Kimberly, she knows very, very well. It's
Okay.
been
Well,
almost 2 months, but
she'll
yeah.
let me know if she thinks I can help in any way. Or if you're looking at other UC campuses, maybe one of our other MPIs can also help too.
Okay, that's wonderful. Yes, for sure. Amazing. Thank you, guys.
Yeah. Okay. Oh, I see somebody is calling in or joining from Sierra Leone, which is not one of our sites at this time. Although there is interest, potential interest in that. The slides. Let's see. Okay. Okay. I see somebody saying they're Elvis from University of Buea. Great. I know we really enjoy our partnership in Cameroon, which is very tightly connected with University of California, Los Angeles. All right. So I don't see any additional questions at this time. We've gone a little bit over an hour. Again, make full use of the website. I know that time is tight. This is the first year that we're going to be, having this earlier timeline for applications. We think it's going to be to your advantage, especially for those who are on the wait list, getting people off the wait list earlier so that people know what it is they're going to be doing. Again, the program starts July 1st every year and goes for 1 year. And I'm available to help. Again, we want you to go to your mentor, your primary mentor or mentors first, but we are available to help as needed as well. Kimberly, have I left out anything at this time?
No, I don't think so.
Okay. All right. Well, I want to thank everybody for joining and look forward to hearing from you if you have any additional questions. Have a good evening, good
No,
day, good morning.
bye.
Bye.
Oh, bye-bye. Bye.
See you, Kim. See you, right?
Bye.
I mean,
Welcome.
Hey,
I'll
Tim,
be in
thank you.
touch soon. Okay, guys. Have a great day.
Bye.
Bye.